Dr. Rubin, and I am a breastfeeding medicine specialist in the Chicagoland area, and I have a direct primary care practice where I do home visits and for general pediatrics and for lactation. And I have started to offer fourth trimester packages as well. And my guest today is Dr. Andrea Wadley, who has been instrumental in teaching me the ropes of having a practice like this. She is the owner of 127 Pediatrics, and they also are a home visit only direct care pediatric practice. They are based in Colleyville, Texas, and they provide convenient and quality pediatric and lactation medical care in the comfort of your own home. And she's offering an online breastfeeding education offering at this point as well. And you can find her on Facebook, Instagram, and LinkedIn. And all of those links are on the YouTube page where this will be housed after the live session. So, hi, welcome.
Hi, thanks for having me.
You are welcome. It's great to have you here. And today we are going to delve into just answering some of the most common questions that we get as breastfeeding medicine professionals. So there's a million things that we get asked. So we kind of picked out some of the more common ones. And if you have a specific question that you are interested in getting answered, you can put it in the chat and we will try to get to it during this chat. And if we don't make it during the live stream, then we will check those comments later and answer in the comments. So to start, let's talk about, a big one, I think, that people worry about, which is, does breastfeeding hurt? And this is one that I think people do talk about when it has happened to them. And sometimes it scares people when they haven't had a chance to do it yet. And they're not sure what it's going to feel like. And is it automatically going to hurt? I assume you get asked that question as well, Dr. Wadley.
All the time. Yes, it's very common for sure. Yeah. So I usually talk through, you're going to have some amount of discomfort. It varies from person to person, but really if you think about your very sensitive body part that has not been used for that, task before, you may have some soreness as you're getting used to it. But I always tell you, extreme pain that's not getting better, is not normal. So you may have, noticeable difference when you first start breastfeeding, but lots and lots of pain is a signal that something is wrong. So always be sure to reach out for help. If that's happening for you. Yeah.
I agree.
Is there anything else you tell moms?
Yeah. I mean, I guess there's different times when we feel pain. So, in the very beginning, just getting used to the sensation, I think is, our nipples are very sensitive and moms and babies are both learning how to do this. And sometimes the fit isn't quite right, or babies initially don't latch deeply enough. It's usually a kind of a wide mouth, deep latch that is most comfortable for mom and most effective for the baby in terms of getting milk. But that doesn't always happen immediately. And sometimes by the time a baby figures it out, there's already some trauma to the nipple. And then that has to heal. So then it's not the latch anymore, but it's the trauma. And so there's a lot of ways that we can treat a nipple to do wound care to help with the healing process. So that's something to just make sure that you're doing right. If you do have visibly cracked or bleeding nipples or sores. And then there's pain, there's nipple pain that can persist, but there's also deeper breast pain that can be at the beginning or start up later. When breastfeeding has not been painful and then suddenly 2-3 months in becomes painful, then it is something that should be addressed. Like that shouldn't just be happening. Something is different with you or the baby that needs to be addressed. So just as Dr. Wadley said, like persistent or severe pain is not normal. So find a breastfeeding support person to help.
Yeah, and you bring up a good point. So when the baby's first learning, if you have any amount of pain, a little bit of pain is fine. But if you're having a latch that just feels excruciating, that is a time to take the baby off and start the process of the latch again. So a lot of moms will be like, oh, I just did all this work to get them on, and I'm just going to curl my toes and fight through the pain. And that leads to problems down the road. So just do your best to take them off and start the process again. And, babies are learning just like anything else you teach them in life as they grow, how to ride a bike, how to eat food, all those things that you go along, you have to teach them how to correctly latch to the breast as well. So. Yeah.
Absolutely. I think I was that mom who just kept my baby on because I didn't want to take a chance that they weren't going to latch afterwards if I tried again. And it's a mistake. I understand the temptation, but I completely agree that pain is a sign that something's not right. So try again.
Yeah.
Great. So next question I have is, how do I increase my supply? And so we're referring to milk production here. And a lot of people start asking this before the baby even comes. And so it's interesting, or it's important to know kind of the physiology of how milk production happens, and what to expect in the beginning, and when to kind of worry that maybe you do have to do something to increase your supply, because that's often not the case. Correct?
Correct. So perceived low milk supply is generally the, top of the differential diagnosis, I guess you would say, for low milk supply. So really you need to know the expectation. So that is part of why I did a, breastfeeding beginnings class, because I feel like people have all these expectations that aren't really physiologically possible. So in the beginning, you have drops of milk, and then it progresses slowly to, more milk in greater quantities, so that by the time your baby's about a month old, you're making about 24 ounces of breast milk in a day, sometimes up to 30 ounces. And that's really what baby needs from 1 to 6 months. So that is something that I think as a culture, we expect things to increase to a place, as you're formula feeding, you're always adding more ounces to the bottle as your baby grows. But really breast milk is kind of a static, as far as volume goes. The baby uses the calories differently in the same volume of milk.
Yeah, I think that's fascinating.
Yeah, I know. It's really very fascinating and very interesting. So a lot of times, you perceive that your baby's not getting enough, but it's not always the case. So, and then there's different milestones that they hit, like around the 4-month mark, where babies become like super efficient, and maybe they're a little more fussy because they're bored and playing and interacting with the world. And, a lot of moms perceive that as they're not getting enough. Their milk is not enough because the baby is only staying on the breast for a few minutes. And then also at that time, about 4 months of age, their velocity for weight gain slows. And so their position on the growth chart can change, which, often stresses your pediatrician a little bit. And so, that adds to your worry about low milk supply, especially at that age. And then as your baby gets older and eats more food, your milk supply is going to naturally go down. A lot of times on our, even our Facebook page for physician moms, sometimes we have to reassure moms, their 9-month-old baby is only eating 3 times a day. And that's because they're eating food the rest of the day, which is what's supposed to happen. So naturally, your breast milk supply will go down. So those are kind of under the realm of perceived low milk supply and why people perceive that, and then we can get into like true low milk supply and what to do about that. But anything else that you have seen as far as development goes?
Yeah, no, I think that was a really good explanation. I think something to know is, the majority of women don't need to do anything special to increase production. It's putting your baby on the breast and letting them give the signals to your breast and your body about when that you need to make the milk. And it truly is a two-way street. And so babies, your breasts need two things in order to get the message, or your body needs two things to get the message that you need to make more milk, which is, and what I shouldn't say make more milk, but just to make milk at any given moment. They need nipple stimulation as well as breast emptying. So, one situation that I guess would be a common one that we see milk not increasing to where it needs to be is when a baby, the milk is there, but a baby's not taking it as well as they should. So they take less than they should, and the breast doesn't get emptied or as emptied as it needs to technically feed that baby. And so then your body gets the message it doesn't need to make as much milk. The good news is, I think it's hard when you're breastfeeding to not know how much your baby's getting. And even me just saying this right now might stress somebody out and think, well, then I should be pumping and giving bottles. But then it's an entire guessing game. And the good news is there are people who are watching how your baby's eating and monitoring your baby's weight. And that's really how we figure out whether or not your baby's getting enough milk. If your baby is growing well and gaining the amount that we expect over time, then the proof is in the pudding. Yeah. And I think any pediatrician out there is happy to have you come in to an unplanned visit, not an unplanned, call and make an appointment, but any pediatrician would be happy to put your baby on the scale in between checkups to reassure everyone that your baby's doing okay. And sure, if your baby's not, then there's an indication that something we need to intervene in some way. And it may or may not be that there's not enough milk. It may be a baby issue. So that's just something to kind of remember, is that most of this is going to work out if we direct nurse, but there are situations where that doesn't happen, whether it can't happen or it's just not going well or whatever, in which case we have more of no longer a perceived low production, but potentially an obvious milk production issue. And then we have to figure out what's going on and take other measures. And so we have to increase that nipple stimulation and we have to increase the breast emptying typically.
Yeah, so those are the big things. There's a really long differential diagnosis, how we speak in doctor terms, for low milk supply, but really the main things are what you were saying. So just making sure the breast is empty, making sure the baby's the efficient milk extractor, because, in the beginning, everything is under your hormone control. And then after about a week and a half, 2 weeks of breastfeeding, it moves to the control of the breast. So if the breast's not getting emptied, it's sending those signals that you don't need that much milk. And that's where you kind of run into problems. So increasing milk after that time is very possible. It's just a little bit harder than catching those things kind of early on in the beginning of breastfeeding.
Right. So I think the overall point is trust the process, but that doesn't mean that you shouldn't get something checked if you feel like something's not right, and hopefully can be reassured that it is, or get help if it seems like the weight gain of your baby is not appropriate. Along the same lines, I feel like I often get questions about when a mom needs to start pumping. There's often a pump in the hospital room, and it's almost implied that you should start pumping, but that's not always the case.
Yeah, right.
Yeah. So what kinds of situations would we, or, why does it matter?
Yeah, so I actually wrote an article about this for my breastfeeding site, but so I agree with you that it's kind of drilled into us to pump, and that's part of the process. Well, if you think about a time before pumps were even available and we spent all this time with our babies and we didn't go back to work and all of that, pumps were not necessary and we didn't use them, we didn't need them. But so there's a few reasons to pump early. So if you end up being separated from your baby for whatever reason, baby is premature or was, born term but had some issues and ended up going to NICU, yes, you need to pump. So usually we tell you to pump for the first time within 6 hours of delivery, and then pump every few hours after that. And initially you won't get much milk, but it's really just about stimulation. So the pump is doing the work that the baby should be doing, even though the baby's away. So that is definitely a time to pump. In the first few days, if your baby is super sleepy, is not waking to feed, even though you're trying to wake them to feed, just some babies are just really sleepy. So those are usually those kind of late preterm, early term sort of babies, usually the 36, 37, even sometimes the 38 weekers are super sleepy little guys. So really, hand expression is probably the best for that. But after a while of hand expressing and using a spoon to feed the baby, eventually you're going to have to pump if the baby's not going to the breast. So those are two examples of reasons why you should pump. But if you otherwise have, a term vigorous baby, you did skin to skin in the first few hours of life, the baby went to breast quickly, you've been waking the baby and feeding them every few hours for the first couple of days, and then they start their cluster feeding and your milk starts to come in, those moms don't need to pump at all, because that tries to tell your body that you have more than one baby, and then you get into this vicious cycle of having too much milk. So if you're doing well, baby's latching, baby's having the right number of diapers, you're hearing sucks and swallows, all that good stuff, do not pump. The other time that you get into a little bit of trouble is when your milk comes in and you're very engorged and you desperately want to pump because your baby is milk drunk full off of one breast because it's just so full, so much milk, that your other side is screaming and yelling at you and wanting you to do something to relieve it. So during those times I say, it's fine to use an electric pump for a few minutes, just kind of relieve that pressure. Really hand expressing, even a hand pump is fine for that too. But just don't pump to the point where you're empty on that side, because again your body says, oh great, we have two babies, let's make more milk. And really during the engorgement, the first part of the time when your milk comes in, you're trying to retrain your body to tell it how much milk your baby needs, and your baby tells your body that. So just making sure that you're following those things and not getting into a different problem of high milk supply, which has a whole set of other issues that you have to work through. So, but those are the main things that I tell people. I don't know what else do you think?
Yeah, no, that was perfect. And I mean, I think that's the thing that a lot of people don't realize. We hear more, I think, about low production than high production, and high production does have its set of problems. Some people produce a lot and have no problems, but many people do. And so, we have this adage in breastfeeding medicine, which is to don't feed the freezer, feed the baby, because you really don't need a huge extra stash. You may want, a few bottles in case you're unexpectedly separated from your baby, or you have the opportunity to have a date night and you're going to be separated, or for your first day back at work. But really, even for work, you don't need a huge backup. You need enough for that first day back at work. And then that day at work, you will pump the milk for your next day at work. So if you're having to buy a deep freezer for your milk, you may want to see about getting some help to get that production down, if you're having problems.
Yeah. So if you're not having any problems at all, you're direct breastfeeding, we talk to you about not even thinking about pumping until, after 3 weeks, 6 weeks, ideally, you should let your body settle in and do the work that it's meant to do. So
yeah, and it's more enjoyable, probably.
yeah.
There could be other things going on that could make it tough, but being hooked up to a pump usually isn't very enjoyable. And so limiting the time in those first weeks where you're hooked up to a pump and maximizing the time that you're snuggling with your baby is a good way to go.
Yeah, agree.
So next question. So I feel like this, just through my entire pediatric career, I have heard a lot, which is it possible that my baby doesn't like my breast milk? I think my baby doesn't like my milk. And you gave an example earlier of that 4-month time when babies get more distractible and so may spend less time on the breast. Or, sometimes there are babies that are struggling with latching and get very fussy as soon as you put them to the breast to latch from the very beginning. And that easily gets interpreted as the baby not wanting your milk. But I've never really heard of a situation of a baby not wanting their mother's milk, aside from more rare occurrences, which like allergies and things like that. Our breast milk is made for our babies. And usually in those situations, there's something else going on.
Yeah, right. So, our bodies are made to produce milk for our own babies. So the idea that they wouldn't like it or need it or want it is another piece of mom guilt that we lay on ourselves, right? Often it's just breastfeeding is such an active process. Often the baby is just not wanting to put in the effort for whatever reason because they're not, able to latch effectively. They're hungry and the milk's not coming fast enough. Those kinds of things are usually the main issue. And then like we talked about at 4 months and older, they just are very distracted, learning all these new things, seeing the world, and just don't have the time for breastfeeding and that kind of stuff. So you covered it pretty well. That's usually what I tell parents as well. And then there's the very rare time that, your baby would have like a milk protein allergy or something like that. But most often your diet doesn't influence as much with how the baby acts with the breast milk and those kind of things. So,
yeah. And sometimes, it's again, in those first days where you may be experiencing pain or you're healing also. And so you're frustrated, tired, all these different things can sometimes make the breastfeeding experience uncomfortable or cumbersome or whatever it may be. And babies get a sense of that. And if being on the breast, something about it triggered this negative association, and sometimes babies get stuck on that and don't want to be at the breast. And it's not a breast milk thing, and it's not a mom thing, and it's not a baby thing. It's just like, if I experience something that's negative, I don't want to do it again, or I get stressed out as soon as I'm having to do it again. So in those situations, you may need to pump, give a bottle for a while. And then there are things that you can do to make this a positive place again. So one thing I always tell people is, if your baby's getting fussy, stop trying in that moment, because you don't want to prolong that fussiness at the breast. Try for a couple more seconds and see if something can switch. But generally speaking, once your baby starts crying, put them up on your shoulder, get up, walk around a little bit, change the pattern of what you're doing. Then you may try again. But if you're unsuccessful several times and your baby just keeps fussing, then switch to your pumping and bottle. But then you want to take as many opportunities as possible to continue to do skin to skin when your baby is happy and nobody's feeling pressure to feed the baby. So perhaps right after they get the bottle, put them skin to skin, right on your chest. And then they will start to associate being here with being happy and being full and being comforted. And sometimes they just miraculously find their way to the breast when that's the situation, or at least it starts to break that negative association and makes it more likely that in the future, at some point, your baby will become interested again.
Yeah, I tell moms all that same stuff too. So a lot of times when you're frustrated that the baby won't latch, the baby senses that frustration. And also inadvertently, I mean, no one means to, but you're shoving your baby into the breast and they're just, fussing and crying and you're upset and they're upset. And so, I mean, I agree. That's what I tell them, feed the baby a little bit of milk, calm them down, try again. If that doesn't work, do all the things that you said. So pump, feed a bottle, and then make your chest kind of a happy place where you're not always forcing the baby to try and feed.
Yeah. Well, I got one question emailed to me, which was, how do I know that my baby is getting enough milk? Which is a good question. It kind of goes back to a lot of the other things we've been talking about, but maybe we'll answer that question and then call it a day. But how do you answer when people ask you, how do I know my baby's getting enough?
Yeah, so in the very beginning, when you're first starting to breastfeed, the baby should have about one wet diaper for each day old they are. So that kind of holds true until about day 5. And then after that, you want them to have at least 5 wet diapers a day. And then progressively, sometimes their urine will be more concentrated, those little pink kind of urate crystals. But as your milk is increasing, the urine should soak into the diaper, which is why they made those little cheater stripes, right, for the diapers, because it's hard to see because it soaks in. And then sometimes parents get confused, if it's a poopy diaper, they count it as that, but the stripe is positive, so it's also a urine diaper. So just pay attention to those things. And then stool can be like super variable. So, I was a newborn hospitalist for many, many years, and we really get concerned if the baby doesn't have a stool in the first 24 hours, for milk supply, feeding issues, but also other anatomical issues. So a meconium is this kind of black sticky stool that they have. It's just from all of the dead skin cells and all the other cells that are being produced as they're growing inside your belly. So they have usually one meconium stool at least within 24 hours. And then after that, the stool is kind of variable, but really you want to see that black color kind of stickiness change over to kind of a greenish color, about day 3 or so. And then you want it to transition to a yellow color it has little kind of white specks. We call it yellow and seedy stool, usually as your milk comes in. So by day 4 or 5, we want the baby to not be having any meconium or kind of green transitional stools anymore. So those are ways you can know. So counting diapers. And when you're really tired, that's really hard to do. So there's about 1 million apps for that. So anything you can put on your phone or you can write it down or whatever. So your pediatrician will know so that you can tell them at the appointment. And then another way your baby is getting milk at the breast is you hear them swallowing. So if you're real quiet in a quiet room, you can hear the baby usually swallowing, every few sucks. So when they first latch, they're trying to initiate the letdown. So they're sucking really fast. And then they start to go into the slower, more rhythmic sucking. And then after every few sucks, you should hear a swallow or you should see it. Their little throat will kind of bullfrog out, and go back in. So paying attention to those cues. Also, babies who in the beginning only stay on the breast for a few minutes and then fall asleep versus a baby that stays on for a while and then falls off relaxed. That's the difference. Usually that the baby's getting enough milk in the second example. So those are the big things that I talk about in the very beginning. And then as they get older, really, it's the growth chart and making sure they're gaining the average number of grams per day that we, hold as our gold standard, So they gain, about the same amount of about 20 to 30 grams per day, which I always think of grams. I think it's because I was a newborn hospitalist for so long, but really that's 5 to 7 ounces a week, and then what we talked about before, around 4 months, that velocity kind of slows, so 15 to 20 grams a day on average, and then as they get older, even less. Following their growth on the curve and growth charts. And then really the gold standard is a weighted feed, so finding an IBCLC that has a scale that goes down to a 5 gram sort of increment that can give you a good estimate of, weighing the baby first, feeding the baby, and then putting the baby on the scale again, gives you a rough estimate of how much the baby is transferring from the breast. So those are big things that, you can do at home yourself, and then also invite a professional in if you're having any doubts.
Yeah, absolutely. And also, again, it's all comes back to the weight gain over time. And that's why we have very frequent pediatric appointments in the first weeks, so that we can really watch that and catch it early if there is a problem with weight gain. And then when weight gain isn't going so great later, if that's the case, it doesn't need to be caught on day one. And, I had one patient who was so worried about whether her baby was going to drop off the growth chart. And I just said, you know what, we're going to see you in 2 weeks. Nothing horrible is going to happen to your baby if they don't gain quite as much as they need to. So I think we as parents, we're programmed. I mean, this happens again later with picky eaters, that we're programmed to, this is our job to feed our babies. And so we want to make sure that they're getting enough. And so it's easy to kind of get hung up on it and stressed about it. But that's what your pediatricians are for. We will watch it and we will let you know if we're worried.
Yeah, exactly. Yeah. Let us be the one that worries, for sure.
Yeah. Well, I think we could talk for hours more about this, I'm sure. Do you have any last thoughts you wanted to, little pearls?
So I ended my breastfeeding class with it's in one of the modules, but just really, we as moms put so much pressure on ourselves to breastfeed. That really, even the most perfect situation, it doesn't always work out or work the way we hope or plan. So, we are fortunate to live in a place where we have a very safe alternative. So breastfeeding is ideal. It's the gold standard. It's what we're working for. It's what we want to do. But if you've done everything and you've tried everything and it's just not working for where you are in your life or your journey of motherhood, just please don't let it be the thing. It's not, your worth as a mom is not, measured in how much breast milk you gave your baby. It's measured in how much you care for your baby and do all those other things that are involved in motherhood. So this is just such a short period of their childhood that I believe that you should have goals. You should go for it. You should get the help you need. You should try all the things, but if it doesn't work out, it's okay. So I just don't want any mom to ever feel like this is the weight that we're measuring her against. We want to help her. We want to do the things, but also it's okay.
Absolutely. I always tell moms, if it's getting to the point where it is affecting their own physical or mental health, and they've done all the things, they've gotten some support to see what's going on and try to modify things, then it's okay to stop. And it's important to stop, because if you're not taking care of yourself and your needs, then you're not going to be able to take care of your baby. And no pediatrician or lactating professional is going to be upset with you if you stop. I had one patient who had decided to stop and came for a follow-up in my MA. at my old job came out and said, she said that she thinks you're going to be mad at her because she stopped nursing. And I was like, oh my gosh, absolutely not. I want to help her reach her goals. That's what we're here for. But if the goals have changed or whatever, if it's just that became her decision, I'm absolutely there to support you in whatever you decide. And there's zero judgment.
Yeah, absolutely.
Being a mom is hard for so many different reasons.
Really,
and if
really
there's
hard,
something that we can do to take something off of our plate, we should do it.
I agree. Yeah.
Well, thank you so much. I would love to just tell patients people who are watching where they can find you and what kinds of things they can find that you have to offer.
Yeah, absolutely. So I am on all the things. So Facebook is 127 Pediatrics. I also have a specific breastfeeding medicine Facebook page and a Facebook support group. So if you're a lactating mom, if you're a pregnant mom and you want some extra peer support, and I show up in there every once in a while, look up my information. We'll get you in the group. I also do Instagram Live on Friday mornings with different guests that have to do with moms and babies and breastfeeding. So if you're wanting more education, be sure to tune in there. And then at the end of the month, which is next week, my hope and dream is to have the class ready to go so that people can start taking my online beginners breastfeeding class. So yes, those are all the places you can find me. 127pediatrics.com will get you to most of those places. So.
Wow, that's very exciting. And I think it will help so many people. I know it's been a labor of love.
Yeah, for sure.
Well, thank you so much. And you can find us on the replay. And I'm sorry for the technical difficulties for anybody who was trying to watch this on Facebook. But I'll try to figure it out for the next one.
Awesome.
All right. Take care. Bye-bye.
Thank you. Bye.
Thank you.